Hello, this video is going to review the clinical rotation requirements for the medical assisting program. First, what are your clinicals? Clinical rotations involve hands-on training experience in a healthcare setting, typically a medical office for medical assisting students. And those clinicals allow students to apply classroom knowledge in real-world scenarios, working alongside experienced professionals to gain practical skills and insights into patient care. Throughout this video, I'll be referencing the clinical manual and other documents and resources, all of which you'll be able to find on the MA Resources page pictured at the bottom right of this screen, accessible through the QR code and a website link included in the video description in case you happen to be viewing this video on a platform other than the MA Resources page. So first, let's take a look at your schedule. Students are typically scheduled to start their clinical rotations at the midpoint of their program, and this can change due to individual circumstances, so please make sure to check your schedule on the student portal. Your clinical procedures class start date is the date you'll be scheduled to start your clinical rotations at the medical office you've secured for your clinicals. If you have any questions or need to change your schedule, please make sure to reach out to our MA department at the number listed here. Your clinical rotations are going to consist of the classes shown here: clinical procedures, laboratory procedures, and externship. Your clinical rotations are going to require the completion of your online course component at the same time you're working at a medical office, completing a specific number of hours each week and completing a specific number of skills each course. The first two classes, clinical procedures and laboratory procedures, are referred to as your preceptorship classes, in which you'll be working 10 unpaid hours a week for the 4 weeks of each class. The externship requirement is 40 unpaid hours per week for the 4 weeks of the class, noting that you can take a 4-week extension for the externship if needed, allowing you to work 20 hours a week for 8 weeks. However, before you can begin your clinical rotations, you do have what we call prerequisite classes. These are the 7 core medical assisting program class prerequisite courses, meaning they have to be successfully completed before you can begin your clinical rotations. You'll also have some general education courses you'll need to complete as a part of your program, but because they're not prerequisite classes, they may occur before or after your clinical rotations. So let's take a closer look at the hours and the paperwork that is associated with these hours. You'll be working 10 unpaid hours a week for 8 weeks, followed by 40 unpaid hours a week for 4 weeks, for a total of 240 hours. Following this standard schedule, you will be at your clinical site for a total of 12 weeks. Keep in mind the hours required for each class must take place within the course term for which they apply, meaning you cannot work extra hours during one of the preceptorship classes to apply to your externship class that hasn't started yet. At the end of each week, you'll submit a timesheet that requires your signature and your supervisor's signature. At the end of each class, you'll submit the 2-page skills form completed and signed by you and your supervisor. Now let's take a closer look at these documents. You have a timesheet. You'll be filling out your name, the site information, the course name, and the week of the class, whether it's week 1, 2, 3, or 4. You'll write in the date, the time you were in, the time you were out, your daily totals, and at the end of the week, you'll total your hours for the week, following the guidelines for the course. It must be signed and submitted to the email shown, as well as submitted to your class. You will need to obtain a rating of 3 or higher on at least 70% of the total skills shown, with a minimum of 50% of the skills coverage required from each of the 5 competency areas you see here. So for your first class, clinical procedures, you'll have this skills list with you, and by the end of the term, you will need to have earned a rating of 3 or higher on at least 70% of the total number of skills, with at least 50% of the skills from the clinical competencies area, administrative competencies area, 50% from professionalism, 50% from medical law and ethics, and 50% from effective communication. However, remember, you need 70% overall. So while it does require that you have at least half of the skills in each area, you'll need to meet that 70%. So for example, You may have 50% of the clinical competency skills addressed with a rating, 50% of the administrative competencies, but for page 2 in the professionalism, ethical competencies, med law competencies, effective communication, patient interaction competencies, you would need to have 100% of those. That would allow you to meet the requirement of having 70% of the overall skills while having at least 50% from each area. That's just an example. The more skills you can cover, the better. Also, please know it is important that all paperwork submitted is accurate and correct. Any misrepresentation of time, skills, or other reporting data can result in dismissal from the program and/or the university. So let's talk about the locations of the clinicals. Students are responsible for securing their own clinical site. Common locations are going to consist of an outpatient setting, meaning a physician's office or an urgent care setting. Students are most often accepted with primary care physicians, OBGYNs, and pediatric offices. However, specialty offices such as cardiologists might be feasible if the office is able to offer the coverage of skills required. That's something you should be inquiring about during the interview process. Locations that would not be acceptable would include ophthalmologists, chiropractic offices, dental offices, or assisted living facilities because they don't offer the skills coverage required for the program. Also, you might note that hospitals are not a typical placement for MA students for clinical rotations. Keep in mind that you should only be reaching out to offices that are feasible placement options, meaning you have the ability to commute to that office, the office offers sufficient hours to meet the weekly requirements of the class, with considerations to your own schedule and availability. However, it is important to note that you should expect to be available during daytime business hours when your medical offices are typically open. There are resources and guidance on how to go about securing your clinical site on the MA resources page, including a phone script recommending what to say when you're inquiring with an office. Let's visit that resource page now to go through some of those guidelines and resources. Our MA resources page has lots of helpful information, including everything that you need to know about your clinical rotations, how to go about the search process, and all of the paperwork associated with your clinicals. We have step-by-step instructions set up to help guide you through the process of securing your clinical site. Step 1 is reviewing this video. Step 2 is going to be reviewing the Medical Assisting Clinical Manual. It is long, but it's important that you go through this in detail before you reach out to any offices you're interested in working with so that you understand what you're asking for and can answer some of those questions they might have either during the inquiry or during your interview. There is also a clinical manual video review that goes through this manual with you if you prefer that format, but keep in mind you are held accountable for complying with everything in this manual, so you certainly want to make sure to read through it thoroughly before you start your clinical rotations. Step 3 of your search process is going to be actually starting to reach out to offices. But before you do that, you need to go to the student portal, find out when you're scheduled to start your clinical procedures class, as this is when your clinical rotations start. Then you also want to find out when is the deadline to submit your paperwork. That's going to be 2 months prior to your clinical procedures class. You need to submit your contract and all of the onboarding requirements to Kaiser University, as described below, to make sure that you're able to start on that schedule. Then you can use the resources throughout this page and the documents to start either calling medical offices or dropping off the facility packet found in Appendix B of the clinical manual to inquire about working with those offices. There are resources on this page. I'll go through those in a moment. Once you have secured your clinical site, you want to submit your signed contract found in the facility packet of that clinical placement manual. It's the last item on there. You and the office are both going to need to sign that. You'll fill out the assumption of risk and waiver liability form accessible here. Submit that to Kaiser. And then you'll open the clinical placement packet. There is a checklist of items in here that you'll need to submit prior to starting your clinicals. Again, this is due 2 months prior to starting your rotations. We need time to process things and make sure we have you in the right class. And again, there's a video tutorial that reviews that packet as well. So some other resources you're going to see on this page, real quickly, I'll just add, we have this clinical site map where you scroll in, click on the dots. You can look geographically to see where students have worked in the past, but make sure to read this disclaimer here when you're using the map. You can click on this arrow to view a bigger version of the map. Then we have a couple of pages of resources. Of course, your academic calendars. We have a clinical orientation that's offered every term. You can use WebMD. So let's say you don't find any medical offices that are on that clinical map. WebMD also has a doctor finder where you can search by specialty and by zip code. You can also reach out to your own physician, people you might know in your community. There's other information about things you might hear as far as, do we have liability insurance? Yes, we do. We have some interview resources here that might be helpful for you. And then we have some commonly asked questions. What happens if I have an office that doesn't meet the skills? Can I work with my employer? Lots of different questions that you might run across. So it's great to peruse this page before you get started. And then, of course, there is a link to the upcoming clinical orientations. As I mentioned, those happen every term. The join link will be found here. It also gets posted in your core classes and sent out by email. But then we also have some information on this page for later on, like your RMA exam information, additional credentials to consider. So lots of great resources to check out. But I hope you found this video helpful in getting started with your clinical search. If you have any questions, please reach out to your clinical advisor if you know who that is, or you can reach out to the MA department at 1-888-4-KAISER.